Yeah. Yes.
Which device is it? I know, you're muted everything. Yes.
A lot of random people. It's like anyone can see. 2 years. Well, I felt welcome people. Yeah, so I came from. Oh, okay. Yeah. I'm from Philadelphia. Philly. Oh, Philly. Yeah. Brooklyn.
All right, everybody. I'm going to start us off with a round of introductions, as we usually do. And then if other people join us, we'll welcome them in as they come. I'll start us off. So my name is Emily Quinn. I'm the Director of Health and Wellness for the City of Kingston. I use she, her pronouns, and I coordinate the Live Well Kingston Commission, and I generally lead the Travel Well focus team. And then I'll pass on to Nettie, and then we'll go around the room, and then we'll hit up anybody who's on the Zoom. If you don't mind, introducing yourself in any way.
Nettie Garrado, Commissioner.
Okay.
Hi everyone, Marcia Sebro, Project Manager, City of Kingston.
Captain Eric Muse, Pastor and Administrator of the Salvation Army here in Kingston.
Drew, Center for Creative Education, Executive Director, and Ward 7 Alderman.
I'm Kyle Uther, I'm a Perspective Commissioner. Moved here about 2 years ago and I live in the Rondout area. So looking forward to meeting you all and getting to know more about the great work you're doing.
And if I could just pause there, later on the agenda, I'll probably ask you to introduce.
Sure, yeah,
You may have
talk more
already
about
just introduced yourself to the extent that you want to. But in case you
No,
want
that's okay.
to talk about it or
Yeah, of
ask
course.
us any questions, I'll have a place for you on the.
Yeah, we can do it later. Sounds good, thanks.
I'm Anthony Fitzpatrick. I use he, him, L pronouns. I'm a commissioner. I like plants.
You like plants?
Plans or plants?
Plants.
Plants.
I didn't.
Oh, maybe you like plants too.
I say it often.
You know, why not?
Say it often.
My name is Kristen Hessler. I use she, her pronouns. I am Project Manager in Department of Health and Wellness.
Thank you so much. And Katrina, if you're off your phone call, if you don't mind introducing yourself. I see you on the other. Great.
I had a feeling I wasn't going to be able to be in person, and I was right. So if I'm off camera, I apologize. I'm Katrina Williams. I use she, her, they, them pronouns. I work at the Ulster County Department of Mental Health. Sorry I couldn't be there in person today.
All good. Thank you so much for joining us in any way you can.
I'm admitting Katrina Light.
Oh, great. Yeah, we'll let Katrina join and put her on the spot to introduce herself as soon as she's there. Does everyone have an agenda? And I'm going to pull it up on screen. Hey, I see Katrina Light. Katrina Light, sorry to put you right on the spot. Do you mind introducing yourself? We just went around.
Sorry that I'm a little late. I was trying to make it in person and it's like, I'm going to be really late if I do that. So I'm Katrina Light. I am zooming in from my home and I'm happy to be here.
Thank you so much. Thanks everybody for this very prompt meeting today. I really appreciate it. So we have a pretty full agenda as per usual, but we're going to try to get through the simpler things first, and then the highlight of the meeting today, I think, will be the Eat Well Focus Team presentation. That'll be kind of the main part of the meeting today. So let's kick us off first with approval of the minutes. So commissioners who are here today, first of all, let's see if we've got a quorum. 1, 2, 3. Yes, we have 2 online, 3 in person. We have quorum. So then that means that I could hear a motion to approve the March minutes.
I have a question.
Yeah, of
Is
course.
that just the agenda from my agenda?
So what I always do, and this is good information, Kyle, because you probably don't know, and I don't know if any other commissioners want a reminder. What I do every month is I create an agenda of a Google Doc, and then I use that same document to be the notes. And so hopefully you see in the document bullet points that I've added to it. Sometimes Sarah Brainerd is able to help me with that because she's technically the secretary, but I sometimes do it.
Okay.
Does that answer your question? Cool. And I have a printed out copy if anybody wants to see it. So I could hear a motion to approve the March minutes, or I could make any edits to that document, or I could answer any other questions.
I'm not sure.
Thank you, Anthony. Do I have a second?
I'll second.
Thank you, Nettie. So then I'm gonna say all in favor, commissioners. I can hear a verbal aye, a hand. I see Katrina Light online. Katrina Williams, I missed you. I see your hand. All right, thank you so much. Great. So the motion passed. Easy peasy. Love it. Okay, so that gets us to more of our work here. And forgive me while I move my documents around a little bit so that I can see them a little bit better. Okay. I think it was last month that we talked about, basically the topic was sponsorships. And I provided to you all this first document, which was a document that was created in the past that was about new initiatives and focus team criteria. And I was proposing to this commission that we just edit that document to include some guidelines about sponsorships. Anthony was very generous and he met with me and we talked quite a bit about this. And out of that conversation grew an idea that it was sort of two, maybe even three different things. And so I'm proposing now this month a new document that just looks at sponsorships. And so the ask for you all is to review this, let me know your feedback, and eventually I'd love for this commission to adopt it as a guidance document. So I can go into it more deeply today, or you all can take time over the next month and review it, whenever you have time. That's probably the best way to do it. Would you guys like me to go deeper into it this time? Explaining what the document says and all that?
How many pages is it?
One page.
Oh,
I like to try to keep it short.
Yeah, I was gonna say, do I need to sit read, but yeah, an overview would be great.
Okay, great. So the sponsorships can go two ways. Live Well Kingston can provide sponsorship, and some of our projects can receive sponsorship. And I think in here I try to explain a little bit what I think examples of sponsorship are. So for example, sometimes a community organization asks Live Well to place an ad in an event program, right? That's something that happens once a year about. Sometimes a coalition will ask Live Well to cover the cost of a Kingston pavilion. So that's a bit of a sponsorship. If an outside organization wanted to use a Parks and Rec pavilion, they have to pay to use it to clean up the garbage mostly. So Live Well kind of covers that fee, mostly by staff being there. That's how we cover it. Another example is that sometimes there's events. I think you all connected to our community knows about the many block parties, cultural fairs, festivals, all those things. Often different organizations will ask Live Well to table or be a sponsor, and that sort of mostly means our logo gets put on something. Sometimes that means they're asking for funding, so that's a more true sense of the sticky part there. Putting a logo on, it doesn't seem that complicated to me, but it's when they want money. And then sometimes we repost other entities' social media and events, and to me that's a little bit less sticky again. I think we sort of have the value that if an organization or members of organizations participate either on the commission or in the focus teams, we try to support their events by doing that, as long as they align with our mission and goals. So in this document, I tried to lay out some general, I don't know if you call them rules, but guidelines. And that is, in order for us to sponsor an event, it has to align with our mission. That's probably the most important. And then secondly, this second bullet point was from our focus team initiatives document. And that's that it has to be directly related to an identified community health issue, social determinant of health, or support community capacity building. So this is a little bit more of a bigger bucket. It's sort of adjacent, I think, to the mission there. And then thirdly, I feel that the next value is that it needs to be done collaboratively. And collaboration could be, they come to one of our meetings and present the idea. Ideally, it would go on our action plan and be sort of part of our work. But it doesn't have to be. It could be that they email us a paragraph about the project and one of the staff members is able to present it to the focus team. So if someone's not able to join us in person, that's fine. They can still be collaborative. Or there's probably other ways that people could be collaborative. So those are sort of like the three main tenets that I think in order to qualify to be a sponsorship should be. And then finally, there's a few kind of process things that I thought would be a good value. I think ideally the work would be reported on our action plans, which I can explain more about it if anybody wants to know what the action plans. I think it needs to be approved by myself in my role as Director of Health and Wellness, the Director of Grants Management, or the mayor, just to have someone sort of just be aware of it mostly. Then we have gotten guidance as a municipality, sponsorships can be complicated. And this is one of the key takeaways. Almost for what's the term? It's like just on the off chance that it looks bad, we don't want to have to receive a sponsorship by an organization or individual that has a pending matter before the city of Kingston. For example, a housing group is going in front of the planning board. We don't want to then accept a sponsorship over here for a cooking class. It might have the appearance of impropriety. That's the phrase I was looking for. And so we have to avoid that. We don't really have a process for checking that out, but it's sort of like,
Could come to, yeah.
you know, so it's sort of like, for the most part, the people who are involved in our work, we generally know. And so it's sort of an informal process, but it's a little bit more of a value there. Like, hopefully we find out if there's other things going on. Okay. Finally, my thought was that for any of our any of our sponsorship, like if the example that I can bring up is Kristen is sort of leading some cooking classes for us, and we're looking for sponsorship of some of those classes. We've advertised that opportunity on our website. And so that way, anyone in the community who's interested in providing that sponsorship knows of that opportunity. We haven't singled out a specific organization and asked them for money. And that's again part of that sort of municipal kindness that we've received. Okay, I think I said a lot there. Anything to clarify? Any questions about all that? I don't see any hands online.
Can I ask one
Yeah.
question? Who's usually requesting the sponsorship?
So we've had a couple organizations ask for ads in their gala programs.
Okay.
A couple different organizations, like those couple that I've listed, like there is another organization that has asked us to use a pavilion, so we've done that. But we don't have a whole lot of them, but there's a few that have come up, and so I wanted to sort of make some guidance so that we know how to, especially as a municipality, we needed to, I think this through.
And Dr. later, by the way.
Yeah, thank you. Any other thoughts or questions? And then I'll, in just a moment, ask Dr. Later to introduce himself. Okay. Hey, Dr. Later, if you can hear me, do you mind introducing yourself?
Yes, hi, I can hear you. Can you hear me?
Uh-huh.
Yeah, Dr. Later, I'm the Director of Cardiology at Health Alliance Hospital, and happy to be one of the commissioners here.
Thanks so much for joining us. Great. Were you about to say something? I heard you breathing.
Yeah.
Great. So thank you all for hearing about that sponsorship guidance document. So again, my ask will be that you all review this document over the next month, and then we'll put this on the agenda for next time. And either you guys can, ideally, if you want to provide some edits or thoughts, please feel free to edit it, put it right into the document for me. That's the best. But there's many other ways. Shoot me an email with your thoughts. That's fine too. And then we can, yeah, go ahead.
You say provide it directly to the document. Would it be helpful in suggestion mode?
Yes,
So that you can see it. Someone's like,
I know.
all my thoughts.
I was cutting corners in that description. Thank you. That's absolutely true. So, and always, just a good thing to say, Google Documents, I'm happy to share with anyone best practices on how to use them. Sometimes there's a little bit of learning curve there. Great. Thank you all. So we'll review that again next month. Okay, moving on with our agenda. Next up, we've got, so Kyle, thank you again for joining us today. I sent the commissioners an email, your application. Usually what happens is we invite people to come introduce themselves. Feel free to introduce yourself in any other way that you already,
Okay,
you know,
sure.
do say. And then commissioners, what we'll probably do is at the end of the meeting, we'll go into executive session, and then we can just consider the application confidentially. But so we won't make a motion or do any of that. So I'll take it away. Anything you'd like to tell us though?
Yeah, sure.
Or questions about Live Well? This is a great time.
Sure. Maybe I can just give a little bit of a background on myself and why I'm interested in joining as a commissioner. So See, I moved to Kingston, as I was saying to Drew about 2 years ago, so I'm pretty new into the community. I live in the Rondout area. I'm originally from Philadelphia area. I was living in Brooklyn, like it seems like many people. Most recently, I've got 2 kids, 4.5-year-old and a 1.5-year-old. And so I got my hands full at home. And but yeah, we've really enjoyed living here, and it's such a vibrant community with a lot of a lot of social work going on. A lot of people that are really invested in the community, like yourselves, and I just wanted to get involved in some way. So my background is I've been basically over the last 15 to 20 years working with nonprofits and philanthropy as well as in foundations, doing strategic planning, doing research, and helping catalyze and get kind of multi-stakeholder collaborative efforts off the ground with like figuring out strategy for those types of entities, and then also identifying community members that are best placed to play a role in them. And my experience, so I worked for about 5 years with a management consulting firm that advised like nonprofits and foundations on strategy, and also like helping develop these types of collaborative efforts. For the last 6 years, I've worked in global health, actually, so very far from Kingston. I worked for a nonprofit that was working with governments in Africa to design community health programs. So, which is very much a global way of supporting better health, and we have community health programs here in Kingston and many places. And so I've always been really interested in efforts that bring different types of people together to affect change around the social determinants of health. And when I was reviewing your website and looking into more about the organization, I loved the different pillars of work that are being supported. I think you're really taking like a multi-sectoral type of view, which is what I've seen work in other communities on these issues, because they're not, the issues of health, nutrition, aging are interdisciplinary and require like a systems type of approach. So with all the different pillars that are being that are being worked on here, and also just how you're then like bringing that up into one body and coordinating those with like a common mission and vision, just resonated a lot with projects that I've worked on in other places in the US and outside, and wanted to get involved myself. So yeah, I'm happy to answer any questions that you have of me. But yeah.
Thank you. That's a lot. Oh, Kristen, right out the gate.
I always have questions. But I also saw your name on the list for the food systems workshop, so.
Oh, yeah.
It was Angela. Could you mention Africa, Angela Hansen? I'll talk more about it during presentation to everybody about the food system plan, but I was just curious about that, how you got connected with us.
I just got on I went on the webinar where they provided, I think the city had organized it around the food system strategy. And so that's
town hall. That was just like
the town hall, exactly. Yeah. And so I think I put my information in the Google Doc to get like part of the newsletter. And when I got the newsletter, I just signed up for it.
Yeah, that's cool. Okay.
Yeah.
Anyone else have any questions for Kyle? We'll welcome him in. Anyone else? Yeah. I really appreciate that you dug into our documents. That was so lovely of you. And when you described it right now, it made me very proud of the work that we're doing. So thank you for reflecting that.
Yeah.
Oh my gosh, that's some good work here.
Very comprehensive.
Yeah, I was like, all right.
Yeah.
I was like, we're not doing that. Great.
Yeah, no, there's a lot of work going on. I mean, it's like a lot of activities, must be very busy. And yeah, I saw a lot of like similarities when I was looking at the action plans, like in terms of the types of work that you're doing around education, some like policy work. a lot of like workshops. So yeah.
So Kyle, have you discovered your favorite park in Kingston yet?
My favorite part. That's a good, yeah.
Doesn't have to be.
Your top two. First, do you know how many there are?
I like, no, I love the parks. Yeah, they're all very different. I actually just went to that new, well, it's not really a city park, but the Red Fox Ravine that Kingston Land Trust just started up. That's like a really interesting environment. But no, I really like Hasbro Park because, well, it's pretty close to me, so I can walk there, run there. But then the view from up there is really, really nice. And all the work that's going on right now with the Sojourner Truth Park is also really interesting. Curious what, if we're playing any, if Live Kingston's playing any role, because that seems like going to be kind of, it may be in the future a nucleus of fitness and nature and,
I can answer that a little bit, not a whole lot directly, but for example, Scenic Hudson, they just sent a flyer today. They're doing a bike tour to Sojourner Truth coming up in May. So we'll help promote their event. So, sort of adjacent doing that. But if anyone else knows more than I do, I think it's Scenic Hudson. It will eventually be turning it over to the state. So the city of Kingston doesn't own that park. But we do have a park ranger that will be walking up and down the Brickyard path.
Okay.
So it's, you know what I mean, these projects are all a little bit complicated, it's slightly different in each way.
I guess one other question I had was just, does the Live Kingston get funding from non-city sources, or is it all
Yes.
city funded?
Fantastic question. So Live Kingston and the 3 city staff that are here, we are funded 95% from grants. We have 2 major grants. One is a Nova Foundation grant, that's for Live Kingston. And then we have a second program, which is a Creating Healthy Schools and Communities grant program, which Kristen is the lead on. So those are our 2 major programs and 2 major funding sources. I say 95 because a little bit of our fringe benefits the city pays for. But also, we've never gone over our budget, I would like to brag.
All right.
We currently don't cost taxpayers, if anything, very directly.
We also got $1,000 from a Cape Cod Nutrition and Dietetics. Not that much, but like, something extra.
We work very closely with the grants department, so.
Okay, that's what I was gonna ask, do you have your own grants team, or does the city have?
She left. So,
Maybe that's your job.
well, yeah.
But
So-
it's another one of your 10 jobs.
We have a phenomenal grants department.
Okay.
Really, the credit goes to them. They are phenomenal. I don't know if you are aware, but the city, over the course of this administration, I don't know, I'm not fast enough to know the grants number. It's astronomical compared to what it was before this administration. I think that's fair to say. Many of those projects are in different ways related to health. So for example, I am the grant project leader for the mobile mental health program, but that's not directly Live Well work or just work. It's a grant that I'm sort of help supporting. So sometimes the way I describe things is a little bit simpler, but there's even more complications as we go along. Yes, there's many layers, many connections. Happy to talk more about that any other time.
Just if you wanted to support grants. We could always use that. Our grants are amazing. Always more support.
Yeah, well, I mean, I in my previous job that I just left, I'm doing some like independent consulting now, but what I was doing, I was supporting a fair amount on like writing grants for my previous nonprofit. And I actually think there's a lot of interest from philanthropy, foundations, people that have a lot of money in like city-based multi-sector initiatives like the one you have. So I think like the one we're all working on, so I think there's a fair amount of opportunity there.
I love mindsets like yours. Please.
Flip more.
Yeah.
And you come across
We
one.
need you.
Yeah, flip them to whoever our grant writer is, like Emily at the least.
Yeah. Well, again,
Thank you for inviting me.
Yeah, great.
thanks for sharing all that. All right, I'm gonna move us on then to the Eat Well Focus Team Report. And Kristen, you got 3 minutes.
Amazing. Okay, I feel like I can share my screen. There we go. Perfect. This is the first time I'm presenting in Canva, so.
Yeah, I know.
Sorry, y'all. I don't know what I'm doing.
No, you got it, you got it.
Okay,
That's good.
great. Perfect. Okay, so I am presenting for Eat Well today. That is mostly because we still don't have a chair for Eat Well, so I'll put a plug. The chair is me right now, but the chair should not be me. The chair should be a member of our community, but in their absence, I will be presenting. So I just wanted to just give a little bit of ground setting for Eat Well Kingston by bringing us back to the vision, the mission, and the values of this focus team, which were created long before I started with the city in December 2021. So I cannot give you history and context to this, but I feel like they've served us well. So our vision is that everyone is food secure and healthy eating is the norm. And our city with a mission to unite the city of Kingston in developing and sustaining a locally based resilient food system for all. And then I thought it was really interesting that Eat Well has values that have been explicitly defined of inclusion, resiliency, community, environment, participation, and empowerment. And I wanted to kind of highlight these in the beginning too, because we're going to connect to them a little bit later on. So remember these. This just is a fun, this was not a table that we ate at, but it was very delicious. I would like to be at that table. So, I thought with us, with Eat Well presenting a little bit in the first half of the year, it might be nice to recap a little bit from 2023 because Eat Well hasn't presented in a while. And so Eat Well, this is all based upon our action plan, which I've linked at the bottom of this. I'll share these slides as a PDF with everybody afterwards, so you've got that. But there was a lot of education and networking. So we had 6 meetings, 4 different presentations. So I've listed them on the left. This photo, by the way, is from the Hudson Valley Research Lab. So this was through Cornell Cooperative Extension, which was super cool. And that's where they were learning how they were testing different methods of growing apples, which was like fascinating. And then another one to call out was the teaching kitchen that came. So in addition to this education and networking that we do through Eat Well, I think what's really great is that it fosters collaboration. And so I, in the past year, was trying to help to identify all these connections that we make, because I think, my background, both as a nonprofit, but having worked in PR and communications, and sometimes it's a little bit of, it's not as hard like a metric to identify, but it's still really important and valuable. And I see a lot of the work that we do as this relationship building. So these are just some of the collaborations that the focus team fostered. So after Katie Sheehan Lopez, the previous chair, brought in the teaching kitchen from Lenox Hill Neighborhood House to do a presentation, I reached out to them to see if they could host a training for our Creating Healthy Schools and Communities program, which is amazing. We didn't have the kitchen ready at the Annie Murphy Neighborhood Center yet. So another member of Eat Well, Tamika Dunkley, from Season Gives and Delicious, offered to let us use her kitchen for free so that we could host this training with folks from the YMCA Farm Project, from People's Place, from Place Corps. So I feel like that was just like such a great example of Eat Well, of so many different of our focus members coming together, either bringing their resources or coming and learning and sharing together. We also coordinated having the SNAP Bed fruit and vegetable prescription program, along with our Heal Well focus team to partner at the Earth Fair. So we had kind of like a health screening that Heal Well coordinated with Sun River Health. And then we had some of our Eat Well focus team members come in to provide resources for people who are food insecure. So trying to like make these connections and foster this collaboration. And then started 2 different subgroups, the Food and Mitigation Working Group, and the Culinary Nutrition Education Programming Subcommittee called Kingston Cooks. A little bit more on that later on. Communication, I feel like our listserv, honestly, is like the greatest thing. People use it all the time. I love that. If you're not on our listserv, let me know. I got to email Cornell Cooperative Extension, but we'll get you on there. And part of our action plan was to have a feature in the Live Well Kingston / Department of Health and Wellness newsletter each year. So it's linked in there talking about our food system. And we did say goodbye to our longtime Eat Well chair, Katie Sheehan Lopez. She's been, she does amazing work in her like job, and then has been a really great chair. So once again, on the lookout for a chair, you can check with me. Please, we'll go to Calcutta Kitchens. That's my unofficial second office. I claimed it. We can work together on that. And we also did an end of year survey just because I was chatting with a lot of folks and was just hearing a lot of different things. And I was curious to get some feedback from people on how was the work we were doing aligning with that mission, the vision, the values that I put in the previous slide. So just want to learn about our members and, keep this growth mindset, like, celebrating our wins, but also identifying ways that we can continue to grow, continue to increase equitable access. We have 5 responses. There's many more than 5 members that eat well, but hopefully in the future, if we do it again, we'll get more. But this is just kind of a summary. People loved the work that we were doing, but they also saw an opportunity to make participation a little bit more representative of our community, particularly as we talk about food insecurity in our community and wanting to make sure that we are intentionally creating seats at the table for everybody to be a part of that decision making. But I feel like it was overall, like Eat Well is just a really great experience. Everyone was really positive. So looking ahead, we have a very robust action plan this year. And I think that's because as a dietitian and a food person, I'm like, I want to do all the food things. And so trying to capture that into here. So we had 6 goals. I finally did the action plan, which hasn't been voted on by the focus team. I want to make that clear. We only meet every other month. And so without a chair, I wasn't rushing an action plan because I feel like this work should come from the focus team rather than from me. But I wanted something to share with you to show you all the work that is being done, even though we don't have a chair. So I grouped these just to kind of help us out going back to our mission, our vision, and our values. So like our goal 1 is really is accountability to our values. You'll see that broken down in some of the strategies next. Looking to having a vision of healthy eating and a vision of food security. So that's where goals 2 through 4 come in. And then our mission is a local resilient food system, and we are working towards that in many different ways. Don't worry, I'm not going to read all of this. I will share it with everybody. But this is just that goal 1 of reducing silos and fostering community, which, like I said, I think Eat Well does a really good job of. We've got our bi-monthly presenter meetings where we bring in guests that come. So we had one that was about the Medicaid 1115 waiver updates. That is about Medicaid funding reimbursements that are allowable for food as medicine programs and what that means. Next week, we have a presenter coming from the Center for Good Food Purchasing, and that is all about promoting values-based procurement standards, typically for institutions. So the city of Kingston does not actually purchase a lot of foods, but I don't have time to go into all that. Like, Emily's gonna be like, wrap this up. We can talk more about that, but they're gonna be here next week, or on Zoom presenting. And I wanted to make sure all of this information was accessible, creating transparency. And so we have the meetings recorded and they're on now, at least these past a couple ones on the city's YouTube page. And then Emily helped to create a way to put them on the Local Kingston website. So anyone can go back and look at these recordings if they weren't able to attend the meetings, which I think is really lovely. We're also in our off months are going into the community and trying to live up to our name of Eat Well by eating together. Anyone who knows me, I love food. I just talk about food all the time. I'm from New Orleans. I'm just like, food is like my heart. And so I'm really excited about that. We had our first one at People's Place Community Cafe in March. Another big value was to make sure that it wasn't cost prohibitive for people to come. So we didn't want to go to some place that was like really expensive because I couldn't pay for it for everybody. So we went to People's Place Cafe, and hopefully we'll be doing other locations like Tilda's Kitchen in the future. And then we just continue to talk to each other, basically, of those last 2 strategies. Number 2, our goal 2 is develop a teaching kitchen here at the Annie Murphy Neighborhood Center. There's a beautifully renovated kitchen in that space. We have already hosted a couple of community cooking workshops that are now branded under this project called Kingston Cooks. And so we're still working on that. There's a project page for it. There's a ton of information on there that I'm happy to share with everybody. But we was talking with Emily too, I love the phrase teaching kitchen and try to maybe reframing it in that lens because it also allows us to bring the teaching kitchen from Linnettsville Neighborhood House. They came back this April. I'm calling it their annual training in Kingston. They are all down for it. So I feel like it's amazing. So it'll allow us to both have these community cooking workshops that are for community members, for individuals, but also to support our organizations that do perhaps like institutional cooking or any other way that they would like to receive a training. So we're working on that and then just constantly having this community input and feedback. This photo on the far right is from when Place Corps came last week to have their daily lunch and we had a conversation about it. Goal 3 is Kingston Eats. So this is to encourage a culture of healthy eating, food fun, and increase veggie and fruit consumption in Kingston. This project came out of the Creating Healthy Schools and Communities team. So that team includes myself and then a partner from Family of Woodstock and a partner from Cornell Cooperative Extension of Ulster County. We did a pilot last fall and we relaunched again for March through the end of this year. Listed, you'll see the little images. That also has a project page. If you're interested, I can share that with you to dive deeper into that. But that was just creating like a culture of fun and joy around healthy eating by focusing on these fruits and vegetables. We also are partnering with like local farmers, and Land to Learn is an organization that does garden-based education at a couple of elementary schools in the school district. So also connecting to our local agriculture. Goal 4, I think we struggle with a little bit. This is through policy change because we are a policy systems and environmental change program, but still wanted to capture it on here as, this is something I would want the focus team to really identify what's important to them. And this might look like identifying an important policy or education or advocacy and perhaps asking the commission to write a letter of support or something like they've done in the past. I will say through the Creating Healthy Schools and Communities grant, the City of Kingston did update its healthy vending guidelines, which were previously created in 2013. So it's kind of felt, after 10 years, we could update them. And it included a preference for values-based procurement standards, which is exciting. And we have a new vendor who's actually a local food company that is going to be putting in vending machines in, I think, 8 of our municipal buildings. So that's really cool. So that one's just kind of there. Goal 5 is to develop a plan to create a resilient local food system. That one I put in there because we're doing it anyways. This is one that the City of Kingston, I've shared this with a lot of people, is developing a food system plan. It's hyperlinked in here to the Engage Kingston page to help us, strengthen our local food system with a focus on improving food security and access to nutritious foods. So there's a whole bunch of things that we're doing as a part of this. We're going to be hosting some workshops and focus groups. I would encourage y'all to keep an eye out for the public engagement opportunities. Like they'll be at Earth Fair on Saturday, May 11th. They're going to be at the Farmers Market on Saturday, May 4th. We'll have a second town hall also at some point. So I'd love to see you all there. Also, I will say this is often done in collaboration and concert with so many of our other Eat Well focused team members. So it's not just me creating it, there's so many other people who are involved. And lastly, goal 6 is to, support the reduction of food waste at emergency food providers. This kind of was a tentative goal, and Katrina Light is on here who really, she was kind of the instigator for taking a look at this and bringing this working group together. Was the food waste mitigation working group. So just to show once again that trying to use Eat Well as this space to foster collaboration, to use it as essentially we have Zoom and I can create a Google document for you to bring folks together. So those are our 6 goals. I feel like that was a lot. I didn't know how much time I was using, so I went through them quickly. Happy to answer questions about them. There's also this opportunity. We applied for the Better Food Policy Fund, which folks from Eat Well and from the commission helped me with that. It was a lottery, so it was completely it was non-competitive to receive this grant. They said all food policy councils are deserving and we don't want to make you compete against each other. We were not selected in this lottery, but they are supporting food policy councils who were not selected in completing this food policy council self-assessment tool. Their timeline for that is May through June. And so if we are interested in doing maybe a little bit of honest self-reflection on these different topics, they are happy to provide like technical support for that as we do it. Yeah.
So let's go into that, but let's review there's a lot of information.
All of this.
Presented. And so let's take a moment just for questions, because some of it, you know, there could be clarification about what a teaching kitchen is compared to like a,
Yeah.
you know, or anything, any questions that are coming up immediately, and Laura? Do you have your hand up, Jim, or you not?
No.
But you know this one, because these are the fun, these are the photos.
The teaching kitchen, I know that we sent someone there to go with Lennox Hill. It was awesome. I mean, she brought back her stuff and I was looking, I was like, you got this training down there? It was just really, really good. And they said they would come back and visit us. The first week we have to do our cooking for our camp. And so it was really nice. It was exciting. They were excited by what they created. They didn't think they could. And, you know, and I have to say, Naisha said I would never cook that kind of stuff. And now I'm like, it's great. And it's like success. It was really good. Really, really good.
I'm so glad. They get like a huge like booklet of
They gave a great book
recipes,
and, you know, it was really awesome because I was like, look at all this stuff you can cook in the oven. You don't have to worry about doing it all in the range. And you can just pop it in and time yourself and you're good. And it serves like 50, you know. So it was creative as well. So it was awesome.
And if I can make another connection for everybody, the Y is also creating healthy schools and communities, like community nutrition site. And so we've been able to support them with first the vending machines, creating a nutrition policy, but then now with purchasing a new stove, a new oven for your kitchen, so that for your camps coming up or any other person who's using the space, they're able to do this type of scratch cooking because you have like equipment that works,
Right.
which is great. So we're able to connect like our CHIS program with Eat Well and like all of these other things to come full circle.
Should be, I'm excited, you know, bring the kids into the fold as well. you know, so
Yeah, totally.
Very well done.
One quick question, the first objective that you had, the first goal, sorry, is that the good food purchasing? I've heard a little bit about this from, I know the New York State Health Foundation, I don't know if you ever worked with them or engaged with them, but I think they have some investments in that area. And I was wondering, is that the same thing as the values-based purchasing? Is that what you're, okay, so that's like generally the goal of getting the government, the city government to abide by us, like source food according to a standard, so like set of principles, like healthy food and local food.
Yeah, so the Center for Good Food Purchasing typically works with large institutions to follow these values-based procurement standards. And that's like nutrition, environmental standards, animal welfare, fair wages, and oftentimes like diversity and equity. I think are kind of like the big five main groups.
Any worker like considerations?
So I think that's under fair wages, like that's like,
Yeah, cool.
probably not somewhere, like, if you come to our next Eat Well meeting, the Director of Engagement from the Center for Good Food Purchasing will be describing all of them. You know, for the city of Kingston, so these things don't directly impact a lot of smaller municipalities because we don't purchase food. So we don't have, so we're not like New York City that purchases food through like their senior programming or anything. Sometimes it's like done a little bit on the county level, so it would be nice for maybe like the county to be a part of this, but I think our largest institutions here generally are like school districts.
That's what I was gonna ask, like, does the city purchase the food for school districts, for the schools? Oh, no, it's a vendor.
Yeah, so the school district.
What? Oh, well, let's answer that question.
Yeah, so we don't do a lot of that purchasing, but you know, I think one thing that as I talk to folks and listen to folks who are within our food system or have thoughts about our food system, supporting our local food system seems to be a really high value to a lot of people. And so, you know, I think we're trying to find ways that we can include those like values-based standards. This is important, so also last year in the Senate, Senator Henchy is our senator in the state Senate, supported a values-based procurement bill that would allow entities that are using like state, federal, institutional funding to purchase food. Right now, you have to go with the lowest responsible bidder. So you have to go with the cheapest food. It doesn't, you have to go with it. So it passed in the Senate that they would be able to go above that if it meets some of these standards. It's only 10% above the lowest bidder, so, but it is it's a start. It's in the assembly this year, so it is something that New York State is already moving towards anyways, and so it feels like a really good time for the city of Kingston, however that looks, to kind of be like thinking about that too.
And Katrina Light says Real Food Challenge is a similar program that focuses on higher education food purchasing.
Real Food Challenge, maybe that's another presenter, because I need more presenters, so I'll check them out. Well,
Where are they from? Real Food Challenge?
I do not know. I don't know. Katrina is a wealth of information. I don't know if she wants to, she's muted, so I'm not sure if she's available at this moment.
I'm here.
Yeah. Can you tell us about Real Food Challenge?
Yeah, it was kind of the predecessor. It started in, I think, the early 2000s, but it was basically this like student movement that happened, started in Berkeley. Michael Pollan was involved, just trying to get like the 3 main school providers to change up their procurement practices. So they had like a very similar model focusing on workers, and like you basically got like different points for switching some of your purchasing away from the Cisco's and into local food purchasing, but also like you could, get points for switching your coffee to bird friendly. And it was this like very cool rubric that transformed that certain sector. And so it's cool to see businesses looking at it and other sectors getting involved. But I thought maybe some people would be familiar with that rubric as a predecessor.
Cool. Thanks for telling us about it. That's wonderful. Any other questions about the food systems plan? This is a very healthy focus team. Each focus team is a little bit different. When last month you reported on the survey that we did as a commission, the most responders were from Eat Well. So there's a lot of participation, a lot of interest in food. Even in our age well focused teams, we often sometimes talk about eating, there's a lot of connections between it. Eating always comes up.
Yeah.
Any other thoughts or questions for Kristen? If not, then want to go on to that opportunity. You did sort of introduce it already. I guess my question to you, Kristen, is what would the next steps for that assessment be? What should we anticipate?
Yeah, I don't quite know what they are.
Okay.
I know that it's happening in May and June. There's this tool that is, let's see.
And forgive me if you said this, I don't know if you did, but we are some other food policy councils are structured differently than the way we are. So we have Live Well, which is sort of the bigger umbrella, and then Eat Well, which is, we call it a focus team. But we've sort of decided that between the commission and the focus team, we function as a food policy council. Is that fair to say?
Yeah, definitely. I have been doing a lot more work with folks who are doing food policy councils, like the John Hopkins Center for Livable Future. They do a lot of work with food policy councils, and basically their food policy council people told me, they're like, you act as a de facto food policy council, so you can call yourself one. And for the Better Food Policy Fund application, we met all of the requirements. And I would even say through Growell too, because Growell, like literally, they are like the food people, like they like,
right.
Supporting the community agriculture.
Yeah. Even though in name we're not a food policy council, I do think that we still qualify as one. And I think that, so these are the questions that are asked in the assessment. I don't quite know the process for doing the assessment. I think that is what this group will help us with. But I imagine it would require engagement and participation from the entirety of the council, not just from the staff liaisons. So it can't just be something that I do as like person who's like, I'm obsessed with food, give me all food projects. or Emily as the director, or Marsha who supports Grow Well. It is something that we would ask our commissioners. And at least I feel like Eat Well, Grow Well as like our food focused teams to kind of participate in. But these questions, like I said, could be extended towards like the entirety of our commission and focus team. So if folks are just interested in doing a little self-reflection, having a growth mindset, thinking through like what are we doing well, where do we continue to have opportunities to grow as we reach, I feel like it's like maturation stage of the Kingston. Yes, that's it. Just maybe answering some questions. I think that is probably what the ask is.
Yeah.
It's answering questions.
Cool. So does it sound like we have to make a decision about it tonight? Sounds like we're waiting to maybe find out if there's more of a tool coming, or no? This is what we.
So I told them we were interested. I did not
Okay.
commit us to doing the assessment.
Yeah.
But I did say that we were interested in learning more.
Great.
So I can, as they share more information, perhaps send that out. But just know that the timeline for them, they said, is like supporting it in May through June. So it's something that's coming up soon.
Okay.
So I don't know if there would be like, you would get it and then would have enough time for the next commission meeting to decide whether we wanted to do it. It would be like, hey, take a look at this, please fill out this assessment.
So more to come there, I think, right? Unless you all were like, no, we're not interested.
I would be interested personally.
Do you, sorry if you already said this, but do you know what it's going to be used for?
This is, the intention, from what I understand, was that, sorry, we did not award you the grant that you applied for. We will provide support and resources in another way. So it's really it's something that I think they're intending that we use for ourselves for self-reflection and then to identify goals or areas of growth or areas of like amplification. Like I think that's more what the intention was like for us, rather than for an outside third-party entity to use that information. They might, and maybe that's part of what we would have to agree to is that they would want to use it, but they did not express that. I'm sorry sharing this.
Yeah, I was just pausing.
These are maybe some, I think it's the other cases.
Yeah, I have them sort of on the side of my computer. I didn't see any hands up, but it's good to see them. All right, last chance. If not, I'll move us on. Thank you so much, Kristen, for that comprehensive presentation. I appreciate it. Next up on our agenda is to come back to this commission's action plan. Let me share my screen. And a reminder that, so as we've sort of touched upon in a few different ways tonight, each folks team has their action plan, and then this is the action plan for this commission. So again, this is the official City of Kingston Health Commission called Live Well Kingston, of which is the umbrella. And so I'm going to jump right into sort of reviewing this, and that is that the first goal is to sort of oversee those focus teams, receive the reports that Kristen just did, for example, and sort of occasionally give guidance. Generally, the focus teams come up with their own goals and sort of have, what's the word, like they can control it for themselves, but it's lovely to have a group that sort of can oversee that and sort of give guidance. And so we can dive more into that in a moment if you want to come back to it. The second goal was the one that I got the most feedback from. So for those of you who weren't here last month, I presented this to the commission and then asked that this month we would review it more in depth. So this is the second time we're looking at it. And so I received feedback on that second goal. My first language was different. I think that we had a goal that said that we would, it was a slightly different language there. I'm blanking on it right now, but I received feedback from Heidi and Susanna. Thank you to you both. And so now we have that Live Well Kingston will inform the community and city decision makers about the commission and focus teams. Then in the third goal, this is again sort of where the policy comes in a little bit. The mayor and the common council will be advised on pertinent health issues and social determinants of health. So these are the three, I try to keep this commission's action plan really simple. it's really easy to plan everything. And in fact, these action plans are evolving and shifting every year, and even sometimes as we're making it, we've talked a little bit about making these action plans be for longer than 1 year. Right now, this is a plan for this year, but we can always reconsider the format of this. And then let me tell you that, again, the ultimate goal here for me, or the ask that I'm for the commission, is that you review this, let me know your edits or thoughts, and eventually I'd love for this commission to vote to approve it. So it's not law, it's really just a shared vision that we have. Those are the 3 goals. Want me to dive into them deeper? Anybody have any questions about that before I go further? Yeah, go ahead.
Didn't you ask us to like review so we could like give that this time?
I did, but there's no rush on it. So again, sort of as Kristen mentioned with the equal action plans, we've, in years past, in all, if I just be sort of blunt, in years past, we've not successfully had action plans that, ever got approved. This is how it's really about, to me, I see that it's a vision that we use to help us structure the work that we do, and they're guidance documents. If we don't get to vote on it tonight, it's fine. So there's no urgency there. But I would like to have that shared vision at some point. Because then we can kind of, in some ways, check that box and start to do the work or move on and put it to bed until next year when we have discussion all over again. Questions about this? So let me just, I guess I will, if no one's raising their hand, I'll dive in just a little bit more into goal 2. So that was about the communication strategy. So the 6 focus teams that we have sort of look at the social determinants of health in different ways. Also at the Live Well Commission level is a goal for communications. So each focus team also, you may see in their action plans, have goals to communicate about the work they're doing or other programs. But I sort of feel like at this level, there's a need. And you'll see with the feedback that I got from folks, I was really struggling with a little bit about those SMART goals and some real tangible things. And I realized that really the goal I suggest is that I create a bit of a report to you of communications that are happening already. And then we can start to make a goal for what we want to, increase or improve or shift what our audiences are or what the strategic communication is. So before I got into the weeds of those specific goals, like increasing the reach of the newsletter, I wanted to back up and just actually make a bit of a report for you. So that's my goal for you in one of the upcoming months, is to have that kind of a report for you.
How did it, each focus team does their own communication, I guess understanding who they communicate to as well, because I think, are they going to the Common Council as well and reporting?
Oh, no.
So that's purely our role, so that should be pushed upward and say, hey, we could really use your support on this. And then we would be the ones who would make that presentation to the Common Council of an issue or identify something that we need to bring forward.
No, that's a great point. And in fact, if Eatwell did sort of send a letter to the Common Council, that might feel a little uncomfortable. I feel like the process really is that it would go through this council.
Okay.
So that's a great clarification. Thank you for that. But examples, I considered like the Eatwell listserv as a channel of communication.
Mm-hmm.
And so they manage, different people just post in that without any kind of approval, So there's all different channels and audiences for communications, the way I see it. And so some of that does make sense to happen at different levels. And thanks for that question, because I think maybe I can clarify that in, if not the report of what we're currently doing, but in the goals of what we try to do in the future.
Where our responsibility lies
Yeah.
to these, focus teams.
Yeah.
Especially, different areas. And being able to, another thing is with all these visits, really understanding, what are critical issues and what are important for the city that should be, we're gonna put a report together at the end of the year. But for the Common Council, I think that's gonna be the barometer to say, how's things going? Where could there be a little bit more help perhaps? So.
I'm sorry, I just realized I didn't ask you to introduce yourself.
I'm Heidi Kirsch. I'm with the YMCA. I'm also officially the chair of this commission. I am the chair of the commission this year.
My apologies, everybody.
Excuse me, Emily, I saw a picture something from Katrina pop up.
Thank you for calling me on that. Let's see what this is. Katrina, yep, you can give me feedback now or email, or again, sort of like any of these Google Docs, if you have a suggestion that you want to do suggested edits in it, that's also a fantastic. It's really hard for me sometimes to interpret. I would, someone has a vision for what it should say, please put it in there for me. I'm not a natural writer. Please just put it in there. But Katrina, if you want to chime in, you always have fabulous feedback.
No, I was just, I'm still feel like I'm a newbie to the group. Just a couple months in. So I was just curious, like, what is, how much I love systems and understanding kind of the protocols. Cause I saw that a couple of people wrote in this last month, and then some edits were made, but then I also in the email said, bring them to the meeting. So I will follow the leader on whatever's best. But I had like printed out stuff and have some notes, but it might just be more concise to send it in an email.
Yeah, unless, how about it this way, like if they are about like the goals and the larger, like the goals and objectives, let's discuss it. If it's like, I think you should change this tactic, maybe that's,
Okay, so like minutia, do it in the doc.
Yeah.
And then if it's more like ideas based, bring it to the group.
Yeah, I mean, because again, this is ideally the commission, it wouldn't just be health and wellness staff moving these items along. Ideally, it's a community here. So I prep this and bottom line it, but I do want you to own it. Or I want you to at least be aware.
It's a living document.
It's a living document, so it is. And that's another point, I think, to Anthony's question. It's up to you all, but we could vote to approve this tonight and still change it a little bit. As long as, I guess to me, do you agree with the goals and the objectives? Like, do you feel like this is the right approach for us?
Yeah.
And then how we implement it, please give me feedback as we go. I sort of feel we can keep doing that.
And I think one of my points of feedback was something that I heard in the last meeting when I was in person was kind of the strategic nature of presenting to the Common Council right before budget season too, like kind of having specific line items to influence the budget for the previous year. So I don't know, I didn't see like when this was given to it just says like city decision makers, but didn't maybe in the strategy, it's like we specify the timing and we specify being very specific about budget. I don't know if that's in our scope or not, but that's kind of how change is made at my organization. It's always around the money. So I thought maybe that would be a strategic timing for us as well.
Those are fantastic thoughts. Great, we can fill that out a little bit here. I'll mention that I was also, just to be honest, trying to make the goals pretty achievable, so that we build momentum. And so in the objective for goal 3 objective, the first objective, I said Liberal Kingston will send at least one advisory email to the Common Council and the mayor. And I thought that could just be our annual report. So our department already creates basically a bullet list of the accomplishments that we've done for the year that gets incorporated into the mayor's annual report that we do. So in some ways we already do it. Let's get credit for it, right? But what we haven't technically done is done a specific email to the Common Council and the mayor saying, hey, look at what we've done this year. So that feels to me like a very accomplishable thing and could check the box. In addition, we could do more. And I think to Katrina's point, this commission has not specifically gone to the Common Council and asked for funding, mostly because we have this grant that funds our department. If in some time in the future, a mayor could remove our department. At that time, this commission could ask the Common Council to fund it, for example, or fund a different program in a different way. I'm not trying to say that we need that now. be super clear, because we do have this money. But there is a role that this commission could play around budget season. This commission could say, the city of Kingston, you should really pay for food cooking workshops annually without having to look for sponsors, and the commission could ask the mayor to.
Yeah.
Let me make sure that I'm getting, the common council sort of has the power of the purse, and then the mayor administers it. So the common council could dedicate funding towards that, and then it's up to the mayor to figure out how to organize that. That's my understanding of the system. I'm learning every single day.
I've heard you say, many times that like if we had a different mayor, we could just like get rid of the.
I'm sorry that I say, yeah, maybe that's.
Is that because like, this department or the health and wellness department isn't like in the charter or the code?
That's exactly right. So this department is not in the charter. So the police department, the fire department, they're in the charter. They cannot be eliminated. They could be, I think, defunded, but they are core requirements of the city of Kingston. The health and wellness department, the arts and culture department, the communications department, there might be a few others, are not in the charter. And so they are been sort of been created.
And can I jump in just to clarify one point too? I mean, I think I was thinking kind of outside what the commission, I think that in each working group, things come up, right? Like even I was really inspired last month when you presented about, why am I spacing? Travel well, that was right. And then I was thinking about like playgrounds and like things that are kind of out, like we don't have the power to like fix the playgrounds, but we could have something could come up in a working group that then has that like, hey, can we push for this? Can we do a little more advocacy work than maybe we have previously? Or like Kristen mentioned in Eat Well, the waste mitigation group, like we're trying to fund little projects based on our own organizations, our partner organizations, but like, wouldn't it be amazing if there was a city project that then we kind of brought to the Common Council? Like this could be something that was funded and prioritized by the city that's kind of outside of our scope, but we do a little bit of like.
Nudging, yeah. I completely agree, yep. Yeah, in your parks example, there's a Parks and Rec Commission, so this council could, a liaison could go to the Parks and Rec Commission and say, hey, Playwell would like to, sees that this could be improved, or saying that would be a great role for this council. There's councils, commissions, so my language is getting mixed. Got it. Okay.
Just to clarify, when it comes to the common council, we can recommend, we're policymakers.
Yeah.
The mayor actually has the power, and we can together recommend changes that we need.
Yeah.
Write up the policy and we can help implement it.
Yeah.
But everything else is the mayor. That's in the charter.
Thanks for clarifying that.
Yeah.
Great.
No worries.
Yeah. All right, do you all want, is that?
If I may ask just one question, how is this commission currently coordinating with the leads of all the focus groups? I'm just thinking about how do you ensure that there's like bi-directional communication? I mean, to the point that Katrina was making around, I think it was Katrina, like around, recommendation or things that are coming out of the working groups, how are then those fed up to the Common Council? And similarly, like if there are areas of the Common Council that the mayor is focused on, how do those get fed from down to the working groups? What kind of role do we play in that?
Great question.
Can I speak on that?
Sure.
Because I know that you've been
Great, go for it.
talking a lot. So if, so the leads for the focus teams are right here in the room.
Oh, okay.
Kristen.
That makes sense.
And myself, so Kristen, I know that Kristen was talking about having, that ideally each focus team have a chair, but we are present in the meeting. So Kristen leads the Eat Well and Heal Well. I lead.
Or coordinate. We
coordinate.
Yeah.
Coordinates Heal Well and Eat Well. I coordinate Age Well, Grow Well, and Play Well. And Emily coordinates Travel Well. And also, both Anthony and Nettie have experience being members of the focus team. Anthony actively participates in at least half, if not all of them, except April. I was looking for you yesterday. You changed your mind. Emily is often on those calls and is great in providing admin like support. The communication, yep, and then like we meet weekly, like in our team meetings, we talk about like this work. The action plans are always a part of these documents. And then throughout the year, here in these meetings, focus teams will present what's happening currently and what's happened since the last action plan, how Kristen started her presentation with a look back of the action plan of 2023. So next month I'll be presenting Play Well. And so just to give some context as to the communication circle.
The other part you mentioned that I think is, so that feels pretty strong to me actually, because we're a pretty small department. We're pretty good at communicating back and forth. And ideally the chairs for each focus team, we've actively tried to have commissioners be sort of a little bit familiar with one of the focus teams so that, but it's informal and there's no.
There's usually just, anyone on this commission, there's always an open chair at all the meetings if you wanted to sit and participate and, just to kind of get a feel. Doesn't take much to sit through one and kind of hear what the pressing items are for this time period, what they're working on. So
the part that you mentioned there that I think is less of a connection is, well, so I, as a department head, meet with the mayor quite regularly about different projects. So he's, I think, pretty familiar with what we're doing. The Common Council, now that we have Drew as a liaison, we have a much better connection. So thank you, Drew. So honestly, we're at the best it's been. But I think like our emailing the Common Council what we've done for the year will be a great next step.
Yeah.
I think we could use more communication.
Yeah. And specifically, if you ever need to go ask for funding, it's always really good to see how much you've accomplished.
Yeah.
Oh, yeah, if there's some funding, so it's not just, it just lays the groundwork, which is really important.
Answer your questions there.
Yeah, I just think that, I guess that's captured mostly in objective or goal 1, around like the effective management and implementation of the project for the commission as well.
I hope so, yeah. So it feels like Katrina Light has a few thoughts. Why don't we, I suggest maybe we not vote on this tonight. Let's keep thinking about this a little bit more. And I feel like if you're all right with that, it feels like maybe we need a little more time on it. We'll maybe adjust it again next week. I'll just pause it again in case anybody has any questions or thoughts. Go ahead, Matt. Thanks, Will. Appreciate you being here.
Thank you. I'll get this.
All right, everybody, we are having an efficient meeting. I appreciate you all for that. Let's see, we are now at the announcements and communications. Eric, you guys go first because you sent in your information ahead of time.
I've learned to get the email to Emily in the morning, that way it'll be on here, so I can go first and be done. The Salvation Army does have a summer camp in Bloomingdale, New Jersey, which is a 4-night, 5-day sleepaway camp for children ages 7 through 12 years old. The Salvation Army has 4 different sessions that go throughout pretty much all of July, maybe the tail end of August. Here in Kingston, we're supporting the first 2 sessions. One is Mega Adventure Camp, and it's a STEM-based camp. So when they're doing all of their activities and things, they sneak in STEM learning, so that way the kids don't know they're learning, but they're just having fun with it. And then the week following is Sports Week, and that's pretty easy to say for itself. So the camp costs us at the Salvation Army $300 per child. We charge $30 as a registration fee to the kids, and the only reason we push any registration fee is because if the parents have something invested, they normally get paperwork back to us and things happen much quicker. That registration fee is always negotiable, but we just put it in writing as $30 and let them know, hey, you're paying 10% of the entire bill. So we have that going on, and there are 2 other sessions that will be going on. They're this summer, another sports week, and I forget what the 4th one is. We are not transporting to those 2, but they are open for people to sign up if transportation can be provided. So we have the ability to take as many kids, ages 7 through 12, who want to go, 12 on or before July 1st. So if they turn 13 on July 2nd, then they can still go. But it's a fun time. I worked at Star Lake for 3 summers when I was a teenager, and I loved it. And yeah, so I just encourage anyone to know that we have that available.
When is registration open until?
It is open until we leave.
And it's, because of this, I'm sorry, can you say again, like when the?
The 2 camps that we're providing transportation to are both the first weeks of July.
Okay.
I know.
I asked because, we are gonna be, tabling, Livewell Kingston, will be present at the Earth Fair. So if you have like materials, it's a really great time where people and kiddos come out and to engage with them. Could I come by Cedar Street and pick up any?
Yeah, we have flyers in English and Spanish.
So we can have them at our
Sure thing.
table.
The first camp is the 8th through the 12th of July, and the second one is the 15th through the 19th of July. And we also have a senior citizens camp that the Salvation Army does. We will be transporting the 17th of June, the 17th through the 21st of June. We're going to be sending folks to that. And thanks to a wonderful grant that is only for Salvation Armies north of New York City, it's free. So you get a week in a much less rustic part of camp. The kids are on one side of camp, the seniors are on the complete other side. They have a whole different lake for boating and swimming and everything than the kids do, so it's a lot quieter on their side, yes. And you can either choose to have a single room or have a double occupancy room. They have twin beds. I believe just about every bathroom is a handicap accessible bathroom. So we will be transporting again. There are 6 sessions for the seniors, but we will be transporting just for June 17th through. Yes.
See you to, we actually just had our HL meeting yesterday, but I think,
You'll love it.
the
They will.
one that's on it, and then we can also share it at church.
Yes, of course.
So,
And it's a great time. The lodge was built in the early 80s. The second directors ever for the lodge were my grandparents. So when I was a baby and went to visit my grandparents, it was at the Star Lake Lodge. And so I have fond memories of that side of camp as well as the youth side of camp.
is your name carved in something somewhere?
It might be, but then I hope it doesn't say plus anybody else, those years as a teenager. But we'll keep that for another day. But yeah, it's a wonderful place. We try to make it as affordable as possible. Free is really great price. And it costs $350 for each of the seniors. But through this wonderful fund that we have, it's free.
Thank you. It will connect with you more.
That's great.
Sorry
Where's
to.
the Star Lake?
It's in Bloomingdale, New Jersey. It's about an hour and 20 minutes straight down 287. Yeah, it's maybe 7 minutes off the highway,
There's
but
a sign where
yeah, you're in the mountain like as soon as you get there. But
it's nice.
yeah, it's
That's
very
awesome.
accessible.
That's awesome.
Thanks so much for sharing that. I don't mean to stop that, but Kristen, you gotta run, so you wanna do your announcement?
Yeah, sorry, I also have a 1.5-year-old, he's a maniac, I have to go pick him up from daycare. I wanted to just follow up on talking about all the stuff that's going on with Eat Well. I can no longer share my screen for y'all of you who are in here. I just posted something today on Instagram. This is a list of all of our Kingston cooks, free cooking workshops that are coming up. So I'll send out like flyers and stuff to everyone. But we've got 5 that are scheduled between May and August. Once again, they're free. They're at the Annie Murphy Neighborhood Center. Some of them are very specific with like our partners from MVP and the Institute for like chronic conditions. And one of them is for toddlers. They're trying to convince me to bring my son, but he's insane. Well, he's insane. Like, I love him, but he's an idiot. He's basically, yes. And then he hugs you and kisses you, and he's the cutest thing ever. And you're like, you just threw like peanut butter at me. And there's going to be one for adults. Those are 2 Kingston Eats cooking workshops. So I just want to put that out there. Like, please, like, promote those. They're free. They're amazing community members. Are volunteering their time.
It's not the city, is it like MVP? City's funding them?
Funding them. So the partnership, MVP, they are paying for everything. They have a health promotions program manager who's a part of Eat Well, and that's her job is to lead them, and they're paying for the food and all of that stuff. The Kingston Eats cooking workshops that are like a cross collaboration. Sunflower Markets is sponsoring the food, so they are paying for the food, and then the instructors are either members of the CHISC team or they're community members who are volunteering their time. I am looking for grants actively because people should be paid for their work, and I would love to pay local chefs and cooks and instructors and community members. They volunteer their time. They're very lovely. The Sunflower is paying for the food. So we've got that. Please share that around. And then also, oh my God, Mike's like, are you looking up? Also, come visit me on Saturday, May 4th at the Kingston Farmers Market. We'll be talking about Kingston Eats, and we'll be talking about the food system plan. So I'll be able to give updates on what's going on there, and would love to hear kind of your input and your feedback. And I think I will see you on May 9th.
For the workshop.
Yeah.
Yeah, cool, okay.
Those are my main things. Okay.
Great, thank you.
Yes.
Go get that boy.
No, that's right. I was like, good our child. No, I have 23 minutes, okay? That take care of it.
Other announcements, and then commissioners, if you don't mind, right now we still have a quorum, so I'd love to keep you so we can reflect on. Earth Fair, May 11th at TR Gallup Park, you mentioned that. Any other, so it could be any other announcements, communications, could be job openings, events, anything else, anybody else wants to announce?
All of our camp applications, sites are open. Our biking program, I think it's already, that's already been started for this, bike it has already been started for the spring. So, and then our annual dinner's coming up on the 9th, honoring, I don't know if you know Bernadette Dorransville, do you know her? She's been working in our childcare for a while. She's awesome. Tim Peck, I don't know if you know him, he's a healthy living guy. Scott Dutton for social responsibility. Moses Edwards is known. He's going to be our employee. And then we're doing a lifetime achievement to Dan Potter, who's been a YMCA member since he was 12.
Oh, wow.
I don't know how old he is. I think he's more than 70 at this point in time. It's been great to a lot of people. It's at Will Twick on the 9th, it's a Thursday night, 5:30 to 8:30. We're trying something different.
And it's gonna be found on the website probably?
Mm-hmm. Yeah. So it's, I'm trying to think, there's a lot of other stuff, but put that in subsequent months. So great.
Nothing new to report. You're looking in my direction.
Great,
Thank you.
all right. Last chance for announcements, communications. Anybody? Okay. Then, guests, thank you for joining us. Thank you, Marcia. Great.
Yeah, nice to meet you.
Gonna stop us.
Hi,
Thank you.
everyone.
Bye-bye.
You gotta jump off.
The parking,
Thank you.
our parking is to the left side of our building.